How's it going, guys? Past level question for pharmacology for step one. I've used this drawing of mine in previous YouTube clips. Not going to be a lengthy clip. A 9-year-old boy, he has a lesion on his head. It's described as a circular area of scaly alopecia. This is tinea capitis, okay? So it's a fungal infection of the scalp. USMLE doesn't give a fuck which fungus causes it, okay? Trichophyton, tonsorians, etc. If they ask you to choose an organism, it's going to be the only fungus listed. Oral griseofulvin is prescribed, okay? Now on one of the family medicine forms for TCK, they show you an image of tinea capitis, and then they want you to know the answer is oral griseofulvin for patient only. Okay, so you have to just know straight up that although sure, you could use various agents for tinea capitis, it's oral griseofulvin in particular for patient only, not for patient and classmates that USMLE wants, which the following is most likely molecular target of the pharmacologic agent. So let's just hop to the answers here. Choice A, this is clearly the cell wall of the fungal cell. Wrong fucking answer. So this refers to the echinocandins, caspofungin, mycofungin. I would say that caspofungin is quite possibly the highest yield antifungal drug on USMLE, okay? Although obviously wrong in this case, the cell wall. So caspofungin inhibits beta-1,3 glucan synthase. It's carbohydrate synthesis. So they can mention caspofungin in the vignette, and they say, what's it inhibit? And the answer is carbohydrate synthesis, or beta-glucan carbohydrate synthesis. USMLE doesn't care about use cases, okay? They just want you to know the mechanism of action for caspofungin. Wrong fucking answer. Choice B, fungal cell membrane, the ergostral membrane. Wrong fucking answer, okay? So ergostral is the equivalent in fungi as cholesterol is in other organisms, okay? So it's the fungal equivalent of cholesterol. Now, this would be the answer for nystatin as well as amphotericin B. They both poke holes in the fungal membrane. Nystatin is used as a mouthwash for oropharyngeal candidiasis. It can be used topically for vulvovaginal candidiasis. Amphotericin B is hard-hitting. It's used last resort for disseminated fungemia. Okay, if you have a fungal infection, let's say an immunocompromised patient where there's rigors, chills, high fever, you give hard-hitting amphotericin B. It's also used for CNS fungal infections, i.e. Cryptococcus neoformans meningitis. Wrong fucking answer. Choice C, azole is wrong fucking answer. Okay, so C is going to be P450 mediated demethylation reaction, or 14-demethylase. So what they do, azoles have a myriad of uses, okay? Fluconazole, itraconazole, etc. What they're going to do on the USMLE is tell you an oral agent is given for the treatment of vulvovaginal candidiasis. Now I said nystatin can be used topically, okay? But you need to know that fluconazole is used orally. They do this on one of the step 1 NBME, it's not my opinion. So they say an oral agent is used for the treatment of vulvovaginal candidiasis, and they ask straight up what the mechanism of action is. The answer is P450 mediated demethylation reaction, or refers to the inhibition of 14-demethylase, which is the conversion of lanostril to ergostrel. Wrong fucking answer. Choice D, terbinafine. Wrong fucking answer. Okay, so squalene epoxidase converts squalene to lanostril, so terbinafine. All right, now I would say the important use case you should be aware for this drug is onychomycosis. So it's given orally, 6 weeks for fingernails, 12 weeks for toenails. USMLE is not going to ask you duration. I'm just giving you some interesting context. Terbinafine can also be used topically for tinea pedis, athlete's foot, okay? I've seen topical azoles like miconazole, clotrimazole used for tinea pedis and USMLE as well. But if you're wondering about use cases that can show up, topical terbinafine, like a spray or foam for tinea pedis, oral terbinafine for onychomycosis, so squalene epoxidase inhibitor. Wrong fucking answer. Choice E, F, G, and H, all wrong fucking answers and don't refer to anything. Choice I, correct answer. Okay, so griseofulvin, it's a microtubule inhibitor. I mean, you say, well, those are supposed to be microtubules. What the fuck is that? Okay, I don't know what to tell you. I mean, the other answers are clearly wrong. Okay, so you need to know the microtubule inhibitors. So griseofulvin does, okay? You can also, if they ask you the mechanism of action, what it targets, the answer can just be tubulin. Holy shit, okay, tubulin. I've seen that in an MBME exam. So drugs that inhibit microtubule formation, griseofulvin, vincristine, vinblastine, colchicine, the bendazoles, not azoles, bendazoles like mebendazole, albendazole, the anti-helminthic agents. And then, of course, you have hyperstabilizers of microtubules, which prevent microtubule disassembly. That's going to be the taxanes, so docetaxel, paclitaxel. Okay, so these are drugs that interfere with microtubules in some form. Griseofulvin is a pass level question, as I said. You know the deal. To make more content, if you like my stuff, subscribe my channel. Appreciate your time. That's it.